I got to the hospital 8 cm dilated. Yes. Immediately I got to the hospital, I was in pain. I was in severe pain. I was given a urinary sample bottle to pass urine. I struggled. I was in pain, but I actually managed to pass urine, but I was in pain, shouting. Then someone came into the toilet and told me to open the door. They assisted me to one of the rooms in the maternity assessment unit. Because of the severity of my pain, a midwife came in and assessed. I was like, oh, you are 8 centimeter dilated. Immediately they have to get the delivery suit ready and also a midwife on ground to ensure that my labor go smoothly. Good day everyone and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today on this video, I'm going to be sharing with you 6 early signs of labor. It's very important for you to get to the hospital on time for proper management and safe delivery of your baby. So the first early sign of labor I want to share with you is cramping. Yes, cramping, which is like similar to pain, which you can say pain, cramping, pain. All right, when it comes to labor is determined by the intensity and frequency of the contraction. Sometimes when labor is close, you might experience frequent Braxton Hicks contraction. Yes, I made a video on the difference between Braxton Hicks contraction and real labor contraction. You can watch this video. But when labor is getting close, you can experience frequency of that Braxton Hicks contraction. But when labor is in place, the intensity of that contraction, the frequency of that contraction increases from every 1 hour to every 30 minutes, from every 30 minutes to every 15 minutes. So that's how the frequency increases when labor is close. So if you notice this tightening of your uterus, that there's a pain around your groin, your abdominal region, it's very important for you to know that labor could be near, that you should pack your things and get ready to go to the hospital. Then the second one I want to share with you is pressure on the lower body. Pressure in the lower body. It simply means that the baby is down and is ready to come out. The baby is already prepared, is already in that particular position to say, I am ready to go out. So it is usually called lightning. It's not the lightning with thunder, okay? This is the lightning that the baby is coming down. So it's like putting a lot of pressure on the lower area. So take note of that. The third one I would like to share with you is the loss of the mucus plug. Back then at home, we'll say, Madam, have you seen show? We call it show. Have you seen show? All right. So when the midwife asks you if you've seen show, if you've seen the mucus plug, it simply means, have you seen that catarrh-like discharge that has a little bit of blood in it? All right. So what happens is that this mucus protects the growing baby. The mucus protects the growing baby. It's like a fence trying to protect the baby from bacteria, trying to protect the baby from infection. So when labor is closed, you know your cervix begin to open gradually. So when the cervix open, it gives room for the mucus plug to fall out. So when it falls out, it's a sign that labor is on the way, that you should take note of it. Then the fourth sign I have to share with you is that there's a change in your vaginal discharge. Yes, as a lady, you already know the vaginal discharge you've been having. But once labor is coming close, your vaginal discharge might become more watery or more sticky, like that catarrh-like discharge, or start having a little bit of blood in it. But if you are bleeding in pregnancy, whether it's your first trimester, second trimester, or third trimester, kindly contact your midwife as soon as possible. That's the number 4th point. Then the 5th point I have to share with you, and if you notice this, run to the hospital as soon as possible. And that is, if you notice your water breaks, run to the hospital as soon as possible. Don't waste your time. Then the 6th point I have to share with you is the urge to always go to the toilet. It's just the baby. You know, I said the baby descended, like the baby lightning has taken place. So because of lightning, there's always this urge to always go to the toilet, because that lightning, the baby's head descending on the lower part of the body, is putting pressure on your bladder and also on your rectum, where your fecal matter, where your feces actually stays. So that's why you're always having that urge to go to the toilet. So these are the 6 early signs of labor I want you to take note of. And also, I want you to know that every woman is different. You get, some women might not experience lightning until it's time for the baby to come out. And also, when it comes to the mucus plug, some women might see their mucus plug or their show and go into labor immediately, while some it might take days before they go into labor. And I also want to let you know that some people might be dilating, but their water will not break. While some people, their water breaks and they're just 2, 3, or 4 cm dilated. Me, I was particularly 8 cm dilated, but my water was still intact and not broken. I want you to know that different women, they have different signs when it comes to labor. Just listen to your body, but these are the common ones with most women. And I think I experienced this. Me, immediately my mucus breaks. Immediately my mucus or my show was out, I went into labor immediately and I was dilating really, really fast. All right. So this is all I have to share with you in regards to early signs of labor I want you to take note of. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.